He says the President and the Congress made things much worse just 3 years ago when they expanded the Medicare program to include prescription drug coverage.
The prescription drug bill was probably the most fiscally irresponsible piece of legislation since the 1960s. The imbalance, well, because we've promised way more that we can afford to keep. $8 trillion added to what was already a $15 to $20 trillion underfunding. We're not being realistic. We can't afford the promises we've already made, much less to be able to piling on top of them.
With one stroke of the pen, Walker says the federal government increased existing Medicare obligations nearly 40% over the next 75 years.
We'd have to have $8 trillion today invested at Treasury rates to deliver on that promise.
And how much do we have?
Zip.
Walker says we have promised almost unlimited health care to senior citizens who never see the bills, and the government is already borrowing money to pay them. He says the system is unsustainable.
It's the #1 fiscal challenge for the federal government. It's the #1 fiscal challenge for state governments, and it's the #1 competitiveness challenge for American business. We're going to have to dramatically and fundamentally reform our health care system in installments over the next 20 years.
And if we don't?
And if we don't, it could bankrupt America.